Well, today in your house, we're talking about an issue that affects a lot of families in San Diego, ADHD. More specifically today, how sleep or a lack thereof affects kids. Joining us with some insight is Dr. Richard Chaffoo. All right, Dr. Chaffoo.
Hi, Jen.
Hello. Talk to me about sleep. I mean, when we don't get enough sleep, it affects people without ADHD. I can't imagine that not having enough sleep does any good for someone with the disorder.
Absolutely, Jen. You know, as you've said, I mean, we all need a certain amount of sleep at night, and certainly growing children need at least, researchers and pediatricians tell us anywhere from 8 to 10 hours of sleep a night. Now, the problem with children that have ADHD is that these children really need even more sleep. And the reason these studies have demonstrated that the children being put on these stimulant agents, which of course they need for their inactivity and their impulsivity and their hyperactivity, are actually causing sleep disturbances. And so there was what we call a meta-analysis, which is a study on a study that looked at about 9 studies across the country because there was some controversy. Do the stimulants actually affect one's sleep or not? And conclusively, they demonstrated that certainly these medications did affect one's sleep, but it caused a problem not only with the child having a delayed sleep, but not very restful or fitful sleep. And so really it's important to understand that these medications need to be monitored very closely by the physicians. Now the problem is that many of these medications, Jen, have a very long half-life, and of course if they're given in what are called a form that's a continuous release, then this, of course, is the best way for the medication. It's given out in gradual amounts. If it goes out in a very quick release early on and a high peak dose early on, then that can affect one's ability to sleep.
Yeah, Dr. Chaffoo, we've got what we call a full screen, kind of something on screen that we can put to show our audience how medications really do impact sleep on these young people. And I would also assume, you talked about the stimulants, but would it be worse too if some kids maybe are on more than one medication, or if they are taking the pills maybe more frequently? That's also got to affect them, I would assume, correct?
Yes, that's a great point, Jen, because you're right. A lot of these children that have the ADHD are on multiple medications, not only one stimulant, but sometimes they'll get a second stimulant dose because a lot of these stimulants wear off by the early afternoon, and they need a second dose in the evening to be able to do their homework and study. And of course, the unfortunate thing is then that can cause problems with sleep as that medication is still continuing later on.
Right.
So it's very important, obviously, following up with your pediatrician, making sure that the medications that you're taking are not affecting one's sleep. And there are some actual medications, things over the counter that some pediatricians will use, like melatonin and Benadryl and other medications that are safe over the counter treatments that may help to kind of counteract. The commonsensical things, Jen, are, if your child has a sleep problem or not a sleep problem, it's important to have a routine. Have your child at night get to bed at a decent time and stay away from those electronic devices when you're in bed. It's better to do something that doesn't require a lot of higher brain function, and taking a nice warm bath, getting to bed at a regular time, and making a consistent part of the child's schedule. Having 6 kids, I mean, I realize that myself. You have to have a schedule for them.
Yeah.
It's certainly it's even more important in kids that have the ADHD because they suffer obviously not only emotionally but academically if they're getting an inadequate amount of sleep. And so it's critical in these kids that the pediatricians, family doctors, psychologists, psychiatrists that monitor them are looking very carefully at sleep patterns and asking questions, and the parents monitoring that as well.
If only those teenagers knew how valuable sleep was and how much they would wish they could get more of it as they'd get older, so they would put down their cell phone and fall asleep, but that would be the magic potion there. Dr. Chaffoo, always great to see you. Happy Thanksgiving.
Happy Thanksgiving, Jen.